Experiencing an acute injury like an ankle sprain or a muscle strain can be quite traumatic. You might be worried about it, unsure of what you should be doing to get yourself better as quickly as possible. Hey, I'm Dr. Notley, Winnipeg chiropractor and athletic therapist. And in this podcast, I'm going to look at the evolution of acute injury care from back when I was, say, an athletic therapist about 25 years ago to now. Welcome to episode 5 of the Own Your Spine podcast, where you can learn about health and wellness and how you can own your health, own your spine. So, back when I first started practicing, we used a principle called the PEER principle. And the PEER principle stood for pressure, ice, elevation, and rest. Pressure involved uh, limiting the amount of swelling around an area. We'd wrap up an ankle. We'd put a tensor around a swollen muscle. We'd apply ice, and this was so that we could reduce pain. We could reduce the amount of inflammation that's occurring. We'd then have the person elevate the limb. If it was the ankle, they'd be lying on their back with their ankle above their heart. If it was their hand, we might actually just have it elevated to aid in some removing of inflammation away from the area, and rest. Don't stress the injury approach. Another term that was used, another principle that was used was called the Rice principle, and it was rest, ice, compression, elevation. It was virtually the same concept, just different wording. The problem with the peer principle is that it's kind of outdated. Um, there's new data that says it might not be the most optimal way to get people better, and also it also doesn't address other factors. They've found that when it comes to getting better from an injury, there's other variables like psychological factors that might actually cause barriers to getting better, and we need to address those for athletes and for people who have jobs where they've been injured. And they also require some form of education, and improving on education helps with recovery because patients, if they understand what's going on and what to expect, they tend to get better quicker. So there's a new principle. There's actually two principles. One of the principles is called the peace principle. And a way to remember that is immediately after soft tissue injury, do no harm and let peace guide your approach. Now, the peace principle emphasizes an active approach to rehab, education. It addresses the psychological aspects of injury. And it also is involved in controlling the amount of stress and strain, the amount of load that you place on the body, and also controlling the amount of movement that's going on so that we can improve tissue remodeling and improving functional recovery. So let's look at that principle. The P in peace is protect. During the first 1 to 3 days of an injury, we need to take stress off of the area. We need to unload it, and we need to restrict a certain amount of movement. Now, what that isn't saying is that we need to be completely off of it and don't do anything. When we unload it and when we restrict movement, what we're doing is we're making sure that we're decreasing the risk of reaggravation, but we're also minimizing the amount of rest. So rest is important, but not as much as the peer principle was focusing on. The reality is prolonged rest actually compromises the amount of tissue strength and the quality of that tissue. When it comes to the amount of load that you place on it, we use pain as a guide. So the amount of protection that we need will depend on the amount of pain that you're experiencing. And also what happens when you do an activity, and if that activity increases your pain, it's a good idea that says, hey, you know what, too much, we need to back off. And then as you continue to improve over the first 3 days, gradually start loading more tissue stress on the injured area, so it starts to adapt. E in peace stands for elevate, and just like when we're using elevation in the peer principle, we are elevating the limb higher than the heart. This promotes swelling to go away from the area towards the heart. Interestingly enough, The evidence is quite poor for indicating whether this is effective or not, but the amount of risk of of using elevation isn't very high, and there may be some benefit. So we keep that in there, just because past experience it does help some people. So let's continue on with it. The A in peace is avoid anti-inflammatories. Now, this is interesting because a lot of people come in and they're doing some type of anti-inflammatory protocol that might be choosing to use some type of medication, or they might be icing. When we look at inflammation, inflammation is actually important when it comes to the care of your injury. It aids in the healing process. Now, one might say too much inflammation may slow down the process, and this may be true. But we also have found with the use of anti-inflammatories, such as medications that are anti-inflammatories, there may be a negative effect on the long-term tissue healing. It may affect the quality of the collagen synthesis, so the formation of your scar. It may affect the development of blood vessels, so what's called angiogenesis. We need blood going to the area to provide the nutrients and oxygen to that injured area. It may affect the healing of the tendon and may also affect bone healing, especially if the anti-inflammatories are used for a long period of time. Now, ice is also one that we are now starting to say maybe we should not be using ice as much because it too can affect the rate of healing as well as the quality of healing. Now, admittedly, in my practice, I have lots of patients who have injuries that they use ice. They use it predominantly as a pain reliever rather than an attempt to decrease inflammation. So we use it sparingly, not for long periods of time, 10 to 20 minutes on, off for a little bit. Just make sure that you have a barrier between you and the skin. But we use it more so as a pain reliever rather than an attempt to decrease inflammation. For that same reason is that we want some inflammation to occur so that the healing can take place. Then the C in peace is compression, and this is just like the pressure part of uh, the peer principle. We can use bandages, we can use tape, and both of these help control the amount of swelling or bleeding that might occur after an injury. They also may limit some movement, but still allow movement to occur. Actually, I find that sometimes when patients are taped and they can walk better if they have an ankle sprain. So it just allows them to still stress the body, but not aggravate it. Now, the importance of controlling the amount of swelling in the area is considering a condition or a sign called pitting edema. So this is where you might have a person with an ankle sprain and it looks swollen and puffy, and you press on that area, hold for a few seconds, and you move your finger away, and your fingerprint is still there. That's pitting edema. Now, pitting edema might actually negatively affect the progress of your injury. With that swelling in there, it may impair the amount of nutrients that can get to the area. It may impair the amount of oxygen that can get to the area. Those are important things in the healing process. Because of that swelling and pressure, we may also have an accumulation of waste products. And these waste products may increase inflammation, which is, we don't want too much of that. We don't want to have the continuation of inflammation, but we do need a little bit. We don't want it to be prolonged. And lastly, it might also impair range of motion, though in the beginning that might be good. Prolonged, that might delay our recovery from our injury. Another part of the principle is the letter E, which is educate. Now, in this case, this is more the role of the chiropractor, the athletic therapist, the healthcare provider. But this is also what this podcast is about, is that we need you to educate yourself, and hopefully I can help with that. But the healthcare provider is responsible for educating you about your injury, telling you what it is or what we think it is, what we should expect from it, how it will progress, over this first few weeks, we expect this to happen. Over the next 3 months, we expect this to happen. Also, how long it will take. So it puts it in perspective for people. And also, and I think most importantly, is promoting an active form of care and managing the amount of stress and strain that we place on it so that we're not aggravating things but we're still progressing things. So that's our job, is to educate you about how you or what's going on, how you should approach your care. Also, educating patients about injuries and involving them in the recovery process helps improve their engagement as well as the overall outcomes. People are actively involved in their care and they know what's going on. They're more apt to do the exercises they're supposed to do or avoid things that they're supposed to do. And ultimately, this ends up in having better positive outcomes. Also, if we can, with education, we can improve positive mindsets about the recovery of their injury. We can improve their overall view of their injury, being more positive that they will get better. That also aids in the overall positive outcomes of recovery. Once we get through those first few days of an injury, we can then start applying the love principle. So, after the first days have passed after an injury, soft tissues need love. What does that mean? Well, the L in love is load. We want to have an active role in people's care. People need to move and they need to stress their injuries. Early stress helps improve the healing of that injured tissue. It stresses the tissue, promoting it to repair and also remodel so that it gets stronger. Also, stressing the area with load improves your ability, the tolerance of that tissue to handle a stress, and also the capacity to experience that stress for a certain amount of time. Optimal loading occurs without increased pain. And this is important because some people avoid pain at all costs. If they think, if I have pain, I should do nothing. And that's not the case. People can actually get better if they can get better even if they have pain. There's some research that says, with, like, for example, a rotator cuff injury, people can exercise with no pain and get better, and people can exercise with some pain without aggravation and get better equally as well. So we can load tissue with some pain as long as that pain isn't increasing. And I actually have a video on YouTube that I'll link in the description, or I'll put up on the video so that you can look at that as well. After the L is O, and that's for optimism. Just like when we're educating in people in the peace principle, we are also promoting optimism that you can get better. People do get better from these injuries. We also have to realize that some people, the way they think, might affect their recovery. A few examples are people who catastrophize, people who look at the situation and they think the worst. You sprained my ankle. Oh man, I'm never going to be able to play soccer again, or I'm never going to be able to go play with my grandchildren again. I'm going to end up in a wheelchair. Like, really overthinking the problem and thinking of the worst possible scenario. Those that think that this situation is worse than it actually is, they actually take longer to get better, and it makes it very difficult for them to get better. Those who are depressed may, because they are injured, they can't exercise, and exercise controls their depression. That depression may bring them down, or the injury may bring them down, and they become depressed because of it. And then the reality is the injury can make them depressed, and their depression can aggravate their injury. So it becomes a little bit of a vicious cycle. And lastly, there's another group who are scared. They're scared of using that body part again, and they avoid it at all costs. I have pain. I don't want to have that pain anymore. I am going to avoid this at all costs. And what we try and do when we're starting to get people moving is we try and put them in environments that they can use that body part in a nice, safe environment, that they don't feel like they're going to get hurt. And if we can promote that and break them of that fear, they can start to challenge it a little bit more, challenge it a little bit more, so that they can get over that hump of fear and get back to recovery from their injury. Ultimately, we want people to be optimistic and to stay positive. And that's our role. That we need to. My role as a chiropractor, athletic therapist, is that I need to look at the positives and focus on those positives as much as we can. There are going to be times where there's negative things that are going to delay an injury and are going to make things recover maybe not as optimally as we'd like, but people do get better in most situations. Vascularization. Now, admittedly, this is an area that I kind of don't always do. We want to improve our cardiovascular health. We want to improve our heart's ability to thump, push blood through the area, and to use that oxygen for our body to function. And with that, with an improvement in cardiovascular health, we tend to find people have more overall physical function. They have an improved work status. So in the beginning, they may not be able to do as much with their job, but because they're getting in better shape cardiovascular wise, they have more capacity to do work. And lastly, and very interestingly, is those people who improve their cardiovascular health also have a reduced need for pain medication. Less that we use of that, awesome. You're getting better, and you don't have to take any medication or any drugs, which is a added benefit. Lastly, is exercise. Well, as I said earlier, we want to load things, and exercise is very important. Now, that exercise might be very specific to your sport. That exercise may be specific to the activity that you do. For example, if you garden and you have an ankle sprain, well, we have to give you exercises that help restore mobility, or we might need the strength to be able to use your ankle to push the wheelbarrow. And you may have some balance issues. So with exercise, we can start improving all of those areas. And balance is proprioception, just so you know. So the improved awareness of where our body is in space. Because when we get hurt, those body parts kind of lose some of their awareness. We can improve that with exercise. Also, with exercise, is that we have to remember that we have to want to minimize the amount of aggravation and pain so that we can promote optimal repair in the subacute phase, and also and hopefully we can limit the person's ability to be in the chronic phase. But if we can use exercise to stress that tissue, tell that tissue it needs repair, to remodel, and it's as strong as it possibly can be, that's what we want to use exercise for. Now, an important thing is we can have pain when we exercise, and I've said this already. We can have pain when we exercise. Don't want to see it get aggravated. And the other thing is we want to be able to progress that exercise. And I think in some cases, a lot of some cases my patients will stop doing their exercises when their pain is gone, but they may still have weaknesses uh, and poor muscular endurance. And I see this with my back patients. You get them out of pain, and poof, they're gone, and we end up seeing them again within a year. And sometimes what that has to do is they haven't changed their habits, but the other thing is they haven't progressed through their exercises beyond the basics. So, in conclusion, when it comes to injury care, in the beginning, the peer principle was good. We stop using the area, we put pressure on it, we elevate it, we ice it. That was great, but we have to go beyond that when we take care of our injuries. We have to develop more than just getting out of pain. We have to take an active approach to our care. We have to understand what we're dealing with. We have to understand, okay, you've sprained your ankle. So what does that mean? How long is this going to take? If we have things that are preventing us from getting back to our sport, or worry or anxiety, or depression, or we're catastrophizing, we have to recognize that, and we have to seek out appropriate care to help get you beyond that. When I was in school, we learned about sports psychology, and that's a very common thing, is recovery from injury. Because if an athlete can't recover from their injury, be hard to get them back to their functioning at their best. And I even have patients who have hurt themselves in accidents, and they're scared about going back to that same job, and so have to deal with that. Refer people off so that they can get past that psychological aspects that's preventing them from getting better. We want to look at progressing our body from a little stress to more stress, so that we can optimize the tissue health of that repaired injury, optimize the amount of blood flow through it, and optimize the strength. Now, remember that not everybody's the same. So, tailoring your care of your injury to the activities that you want to improve upon is important. And working with a healthcare provider to provide good goals that get you back to what you want to be able to do allows us to provide have a more holistic form of care. And that's the benefit of the peace and love principle, is that it's more encompassing beyond just the injury. We're looking at the repair of that injury, hopefully decreasing the reoccurrence of that injury, working at the psychological aspects that might be affecting your recovery, and just, that's the benefit, is that we're looking at things beyond just your injury, and getting you moving better, moving faster, moving stronger, or getting you back to doing the things that you enjoy. So hopefully you enjoyed this podcast and you've learned a little bit. If you have any questions, feel free and message me and ask.